This is the Academy of Health Sciences. It's a 4-year program of study where students who know that they want to work in healthcare can apply and get into this program. They have their classes that are planned out for them over the next 4 years. In each grade level, at least 2 of the classes are linked, so we're doing cross-curricular projects. So in this class, which is Introduction to Medical Careers, we're linked with English 9 for mental and behavioral health. So we're doing projects together. And throughout the 4-year program of study, they'll get dual enrollment credit. So we'll have dual enrollment with Gavilan College. So if they pass some of their classes with a C or better, then they'll get college credit. So that'll just give them a step up going into college. They'll have a college transcript, and it'll take them less time to finish their associate's degree or bachelor's degree, depending on what they want to do after this program.
So the sports medicine program is started out as CTE and it's transitioned into the Academy of Health Sciences. There's 2 sports medicine classes. Sports Med 1 is taught to juniors, and then seniors are in Sports Med 2. However, if they started the pathway early, they can be in Sports Med 2 as a junior, which means their senior year, they're in internships with Hazel Hawkins or other medical facilities that we can get the kids internships in and getting that outside experience. A lot of the kids have to do 75 hours per class. That's a dual enrollment requirement that we have with Gav. So a lot of them do their hours in here with me in the training room, covering practices, games, traveling. Some do their hours at Hazel Hawkins or outside internships as well.
In an intro class like this one, we do informational interviews with medical professionals, and then as they move on in the program, they do job shadows and internships. And when they go through the program, they get industry recognized certification. So this year, my freshmen are getting their first aid CPR AED certification, which is needed for most careers. And then next year, as sophomores, they can get the basic life support, which is what all allied healthcare professionals have to carry. This is pretty unique. We'll be the first linked academy in the Central Coast. That's pretty exciting. So it's a very unique program.
So the partnership thus far has been a lot of collaborating about what we can offer the students and what the high school envisions that the students need as part of a meaningful experience. That's ranged everywhere from identifying what the interests are of the kids. Many think I want to be an ultrasound tech or I want to be a doctor. What we're trying to do is really open their eyes to all of the different positions that are available in healthcare so that they may consider something that they previously wouldn't consider. If you're interested in computers and data technology, there's a place for you in healthcare. If you don't like the blood and guts of things, there's a place for you in healthcare. So we just want to be able to expose the students to every department within the hospital to see if a career in healthcare would be a good fit for them. So the students have been identified by the academy, and then they're connected with a member of our team for what their area of interest is. For example, I've got students who are interested in working in a skilled nursing facility. So what we do is we set them up with the skilled nursing facility to observe the care of a patient. At this stage, we're in the observation phase of it, if you will, that they're observing care being given. And then through a later phase, we're then taking them through a hands-on experience where they can participate in patient care.
So we're really fortunate here. Obviously the training room is one of the biggest, I would say, in the Central Coast section, not just in our area. We have a rehab room, we have the actual training room, we have the water room. The kids are able to come in and learn modalities, they're able to do treatment, they're able to do rehab, prevention, which is really cool. But the kids enjoy it, they love going out to practices and being involved and really getting that hands-on experience.
It's a family in this training room. We are here 5 in the morning some days till midnight during game days, and we really make a family here in an environment with the athletes and the trainers all together, and it's a learning experience, and it's something that's going to help prepare you and grow for the future and really help you.
I think it's a really good opportunity. I wish they had this when I was in high school. Being able to have the Academy of Health Science and graduate with a lot of dual enrollment credit where you basically could walk into college with your GE done and be ahead of all those kids and not having to take they call them weeder classes to try and get you through to the higher level classes. I think that the opportunity is here, and if it's here, that you need to take advantage of it. Even if you find out after your freshman year, hey, I'm really not interested in going into medicine, it's still a good opportunity, and the kids aren't going to be off track because it still fulfills the A through G requirements.